I'm Von Biggs, and let's queer up health. Latest report on how gay men are doing with STI rates. The CDC's latest data reveals progress in combating the STI epidemic, particularly among gay men. Over 2.4 million STI cases were reported in 2023, but overall infection rates are declining. Gonorrhea cases dropped by 7% from 2022, marking a second consecutive annual decline. Primary and secondary syphilis cases also fell 10%, the first major drop in decades. Among gay and bisexual men, infectious syphilis cases declined 13% for the first time. However, congenital syphilis cases in newborns increased 3%, which is a stark improvement from 30% annual jumps. The CDC highlights that marginalized groups, including gay men, face harsher impacts due to stigma and inequities in healthcare. CDC urges that combating the epidemic requires innovation, investment, and targeted prevention. The report brings optimism, but they suggest stronger actions are essential to protect vulnerable communities. You know, I think there's an important thing, and they highlighted it with the genital syphilis, and those rates are slowly increasing, but they're not as much as they used to be. But a lot of that is doing to, like, I know, like for us at Holy Cross, we have a focus program that anybody comes in the emergency room, they get tested for HIV and syphilis, and they get tested for that automatically. It's not an opt-out. I mean, it's an opt-out. It's not an opt-in test. So therefore, you're able to catch those things, and that genital syphilis is so. Once that's caught, it can be taken care of. And we're finding, when mothers come over from other countries or something like that, and they've not been treated, that's where these start to happen. But because of efforts like Focus through Gilead that's done that, and other hospitals they're doing that opt-out testing, it's starting to change that demographic for us. Right. But as far as the gay men, it depends on what area you're looking at. Nationwide, it's always going to look better than it is certain populations like Broward County, which we continue to see increases in.
Yeah, and similar to Miami. I love this story, but my challenge here is the fact that, like, I know, speaking from a Pride Lines perspective, we have a clinic. We've seen decrease in funding to be testing, right? So in the past, we were able to do free HIV testing and STI testing. Well, now we get charged as a clinic for STI testing. And so it puts a burden on a clinic, an organization like Pride Lines, which is a nonprofit organization. We're not for profit. We don't charge people's insurance for the visit to the clinic. It puts a tremendous burden. And I will tell you, the cost per test is, just to send it to a state lab, is pretty expensive. And so it brings us greater challenge for our community when we're trying to serve community, we're trying to stop the spread, we're trying to treat people, but we have these observative course. I've had to stop STI testing temporarily because of the cost. We are hoping to go back to it in 2025 as we think about different revenue streams in the organization, because it is an important part of who we are as an organization and to serve our community and the local communities that we're in. I mean, we're in Liberty City, where we not only serve the LGBTQ plus community, but we serve the much broader community as well. And that community, quite frankly, the statistics are pretty horrible for HIV and STIs. And so we got to get back to that. But the challenge that some of us face is these costs that are associated with it. It's for a service that should be free, right? Because it's a public health epidemic, right? It's not about LGBT. It's about like making sure that we can protect the public. They're not free anymore. So it makes it really challenging for us.
I have a question. Did these changes in cost increase during the last 4 years, or
this last year?
This last year.
So prior to 2024, we did it we were able to do it for free, send our samples to the state lab, and it was great. And then what recently happened is in September, I got a bill, and I'm like, no notification, no anything. I'm like, where is this from? So I just was like, maybe it's a mistake. October, I got another bill.
Is it due to the Republican Party politics? Is it a state political situation?
I really don't know at this point. I haven't been able to get a clear answer from the health department. So it's been a challenge getting a clear answer. It's very confusing, but no one's given me a straight answer about where this came from. But quickly cited. I said, any changes in our agreement, you have to give me notification. I've gotten
you can't
notification.
just send a surprise.
You can't just send me a bill from your lab without even notifying me. So I still haven't gotten a notification. So guess what? I still haven't paid my bill.
Or even a notification about what you're spending.
I don't even know. Like I just got a bill that says labs, $2,000. Labs, 17. And so there's not even like any identifying of what day it was. It just was very confusing. And so I think on a local level, our people are really good at Miami-Dade. And I think that they're just as complex and ask in Tallahassee, like what's happening here. And
I don't think that they've necessarily that we're not aware of yet.
A straight, answer from Tallahassee.
Right.
Wow. But how else can we combat this, right?
Well,
but that's where organizations like your hospital and his Pride Line clinic meet up and try and work out a program.
Do you guys do rapids, like rapid blood
tests,
so you don't have to send it off?
We do. Again, the politics of this, and
I know
we're getting charged for everything, everything.
We'll talk.
Let's talk.
We'll talk later.
Challenging, but but nonetheless, the statistics in the story, the fact that it's going down for our community is a good one.
Good news.
Yes.
That is a big LGBTQ story for today. There's no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.